Uy, part 3 na tayo. Are you ready for some questions, nurses? Yon. If you're new here to my channel, welcome na welcome ka dito. In this video, I am going to make sure na may matututunan ka. And what should you do? Simple lang. Grab a pen and paper. Doesn't matter if it's scratch paper man yan, Manila paper man yan, cartolina, whatever, pen, pencil, pentel pen, whatever. Just grab a pen and paper because I want you to participate. Okay? So every question lasts for 10 seconds. So if you need more time, just pause and answer and really understand the questions, especially keywords. Okay? Passing score 14 out of 20. Ooh, 20 points na kuya. Nakaya mo? Yes. Gawin natin 20 points para sulit na sulit, diba? So don't worry if you get scores below 14, that's fine. Kasi what's important? You learn 20 points. See you at the end kasi check natin to. Good luck! Finish or unfinished? Pass your paper. Charot. Ano to? Classroom lang? Okay guys, check na natin. Tingnan natin if naka 14 out of 20 ka pataas. Diba? If makakakuha ka ng 14 na scores pataas, you can freely scroll. You know the drill guys. Comment below your score para tumaas yung engagement natin and YouTube will recommend this to more and more people. And passing score is 14 out of 20. Pero whatever your scores are, just 20 points pa rin yung natutunan mo. Let's go! So, alam niyo na yung question guys. For personal and professional development, the nurse is decided to hold a staff development program. Self-enhancement through assertiveness. Yun. So, yung question dito, as an appropriate assessment tool to maximize gathering of needs of nurses. Is it A, interview, B, observation, C, survey, D, brainstorming? Okay, assessment tool. No? Keyword is gathering. The correct answer is appropriate. Alam niyo na yan. Interview nurses. That's the most maximized gathering of needs. Diba? Kasi tingnan mo guys, observation survey, wala lang. Hindi naman siya nag-assess talaga. Pero yung gathering talaga is yung interview. Number 2. A priority objective of the program is to... Ano nga yung program na yun? Yung self-discovery ng mga nurses. It's C. Develop the art and skills of therapeutic use of self. As you can see, this is the most umbrella technique. Kung gagamitin natin yung umbrella technique, it encompasses everything. Yeah? Development of art of public speaking, positive image of the nursing profession, continuing education units, they're all good, di ba? Kaya si C, art and skills of therapeutic use of self. It encompasses everything. Number 3. The most effective way to practice assertiveness skills, keywords is through A, written, B, descriptive report, C, process recording, or D, role play. Keyword here is skills. No? Kasi alam naman natin yung assertiveness. Assertiveness is you dinidefend mo sarili mo if alam mo namang tama ka. You're being assertive of your rights, of your knowledge. If alam mong mali, and you say, parang mali to, that's being assertive. Tapos keyword natin is skills, guys. So, sa lahat dito, guys, alin lang yung may skills na element? You're right, it's roleplay. No? Tandaan, we develop skills through practice. And role-playing is the same as, anong tawag din sa school? Return demonstration. So, return demonstration is a good way to evaluate our skills. 4th, the least satisfactory. O yan, negative yan method to evaluate the effectiveness of the program is through yung hindi daw, yung pinaka-least satisfactory, yung hindi maganda. Diba? Is it A, group discussion, B, return demos, C, attendance, or D, interviews? Diba? Alam mo na yan. So, the least satisfactory of evaluation is attendance, diba? Kasi hindi ibig sabihin na nandun siya, nakikinig siya, or minsan nga, diba, nililista na lang yan. Uy, gawa niya din yan. Pero guys, tinitingnan nyo yung may kulay. Of course, hindi naman tayo magkukulay sa board exam, diba? Pero always highlight the keywords para at least mabilis na sa'yo mag-pick up. Ay, we're finding the negative answer. Ay, we're finding the positive answer pala. Okay, 5. Which of these feedback from individual participants indicate maximum gain from the staff development program? Maximum gain. Ito yung sinabi ng mga nurses na sabihin mo, ay okay, maganda yung program ko na ginawa. Is it A, I will write a plan for personal development program. B, I will feel very good. This program inspired me a lot. D, I learned a lot. I hope to have more seminars of its kind. D, I have a do-it-now project for myself. Example, to approach my clinical supervisor regularly to discuss nursing care of our clients. All of these things are correct. All of these answers are correct. Which one is the best? No. Alam niyo na yan, guys. Usually yung pinakamahaba. I have a do-it-now project for myself. Approach my clinical supervisor regularly to discuss nursing care with our clients. So, actually yung A, B, and C, okay naman sila. Pero ito talaga yung letter D yung the best. No? Kasi merong action. Tandaan, di ba? Role play is the best indicator of assertiveness. Tapos return demonstration din yung tamang um, evaluation tool para malaman natin if may natutunan talaga yung mga nurses or what. Situation. A vehicle hit some pedestrians while waiting for the bus. Some of the victims suffered injuries of the different parts of their body. Josephine confirmed that he had a fractured left arm. Tapos si Josephine is anxious. I already underlined the keywords. Number 6, to reduce anxiety. Anxiety. The nurse teaches the procedure to the client. Which of the following topics should not be included? Oh. Is it A, leave the cast uncovered to permit drying? Tama. B, bear the weight of the plaster. A stockinette will be placed over the left arm and placed in cast. C, handle hardening cast with palm of hands. Tama. Trim and or shave finish cast with knife cutter. Tama din. So, should not be included is B. Bear the weight of the plaster cast for 1 hour. Hindi ko alam yung exact rationale dito, guys. Kasi I tried searching it on the internet. Pero, parang hindi naman siya trabaho ng patient. For me lang ha. And yung stockinette kasi, hindi naman siya ipi-place over the left arm. Pero if you want to know more of these, pwede nyo itanong yung teachers nyo, guys. I'm really sorry. I'm just gonna be transparent with you guys. Hindi ko talaga alam yung sagot na rationale dito, pero ito yung tamang sagot. 7. Cast was applied on Josephine's left arm. In assessing the neurovascular status of the client, which of the following assessment findings should be reported to the physician? Neurovascular status. Paano daw natin malalaman, guys, kung nagba-blood flow pa daw ng tama or meron pang blood flow na correct na napupunta sa extremities ng client. So, alam niya na yan, guys. A, B, C, and D. Ang tamang sagot ay D. Nail bed capillary refill time of 10 seconds. Bakit mali? Bakit ano to, guys? Kailangan siya i-report sa physician. Kasi, yung normal capillary refill time is 2 to 3 seconds. Diba? So, 10 seconds, guys. Sobrang tagal na nito. Ibig sabihin, siguro sobrang tight yung cast na hindi na naka-flow yung blood. Tandaan, guys, ha, blood flow or yung blood yung nagpo-promote ng healing sa wounds natin. Kasi blood contains all the nutrients, tsaka water, tsaka lahat ng mga nutrients ng cells. So, blood is very essential. So, to check for cardiovascular status, ipipinch mo yung fingers and check for the capillary refill. One of the victims, a 60-year-old woman, sustained a hip fracture. Prior to surgery, a box extension traction is to be applied. The rationale of traction is primarily based on the understanding that box extension fraction is, ano daw yung function ng box extension traction? The correct answer is A. It reduces muscle spasms and help immobilize the fracture para hindi magalaw-galaw. 9. Philip was placed in skeletal leg traction with an overbed frame. He is not allowed to move from side to side. Which of the following nursing intervention is useful in maintaining effective traction? Paano daw malalaman, guys, na parang daw ma-maintain? Yan yung correct keyword dito, maintain. Ibig sabihin, ito yung gagawin mo para hindi na ma-further yung injury. I-maintain na lang. So, to maintain the effectiveness of the traction, kailangan mo siyang i-monitor, di ba? You have to check the apparatus that weighs the hang-free and nuts in the rope are tied securely. I-check para ma-maintain natin. Baka if loosened pala yung leg traction na yun, baka mas ma-further pa na mapilay si pasyente. So, we always need to check for us to maintain the effectiveness of the traction. 10. To prevent complications when a child is in box traction, the nurse should to prevent complications daw, no? Prevention. So, we need to check, ano nga ulit, guys, yung kanina kay Josephine, yung sa 10 seconds, di ba? Yung capillary refill. So, we need to assess any skin and circulatory disturbances. Always check for it. Kasi napakahalaga niyan, guys. Especially pag may mga casts yung pasyente. May mga traction. Napakahalaga niyo. 11. All of the following concepts are true except we're finding for the wrong answer. So, hostility is destructive, tama. Frustration develops in response to unmet needs, wants, or desires, tama. Aggression can be expressed in a constructive as well as destructive manner, yes. See, anger is incompatible with love, no. Kasi minsan, kailangan din natin magalit sa mga taong mahal natin. Char. Para magbago din sila. Or para alam din nila na nasasaktan tayo. Oh my gosh, nakakaya. As you notice guys, may mga ganito talaga sa board exam, as in may mga out of the blue questions, like under the sun na mga questions na parang hindi ka prepared, matatawa ka na lang kasi ba't natanong pa yan. So, always lang analyze properly. 12. Carlo is acting out hostile and aggressive feelings by kicking the chairs in the room. The most effective way to deal with Carlo's behavior is initially. Minsan, sa sobrang excited natin sumagot, guys, we always choose the best answer. When, in fact, yung tanong lang naman is initially. At first, ano yung gagawin mo? O, tingnan mo. Administer PRN tranquilizer, pwede to. Kasi hostile naman si pasyente eh. Ito yung ginagawa usually, guys. Tranquilizer yung talaga sila. Pag sobrang hostile na nananakit na sila ng tao. Remove the chairs in the room. Tama din naman. Restrain the patient. Tama din. Ginagawa din to, guys. No? Ginagawa din to talaga sa pasyente na hindi na talaga makontrol. Tama. So, probably, ito yung tamang sagot. Pero initially, before mo gagawin yan, ano muna? So, we have to, muna. Set limits by verbal command. Sabihan mo siya, tama na yan, ha? Mrs. Deason was visiting her son at the psychiatric ward. Which of the following items will the nurse not allow to be brought inside the ward? Not allow. So, yung sagot dito is, bawal yung bottle of Coke. Alam niyo kung bakit, guys? Kasi pwede itong gamiting weapon or gamitin siya ng panakit ng ibang tao or sarili niya. Which of the following will probably be the most therapeutic for a patient on a behavioral modification ward? Most therapeutic. Tandaan, guys, yung pinaka-most therapeutic sa psychiatric nursing is always therapeutic communication. Tagal pa ha. Theracom. It's always giving support and positive feedback for controlling use of obscene language. No? If si patient, tinatry niya yung best na hindi magmura or hindi magalit, i-praise mo siya. Like, grabe, ang galing mo. Thank you for not swearing. Which of the following must be considered while planning activities for depressed patient? For depressed patients, guys, kailangan siya ng mga structure. A variety of structured activities. Wrong si D kasi unstructured. Usually, guys, ito yung mga opposing answers. Ito lagi yung natitira choices sa board exam. Pero wag kayong magpaniwala dito. Coincidence lang yan. Pero yan, depressed patients need structure. They also need to structured activities talaga yung kailangan nila. Kailangan may routine sila na sinusunod para hindi sila na masyadong ma-depress at parang medyo may control sila sa ginagawa nila. Jason, age 25, recalled his problem began at age 15 to 16. He would count pencils in a mug over and over. This is an example of obsession, with the thought that stopping could result in something bad happening. This is an example of compulsion. So, technically, meron siyang obsessive compulsive based on the symptoms na dinidisplay ni Jason. There are many things Jason seems he has to do to keep himself from feeling what? A. Confused, B. Excited, C. Suspicious, D. Anxious. Tandaan, obsessive-compulsive disorder is a type of anxiety disorders. So, check nyo nga guys yung tatlong personality disorders yung obsessive-compulsive. Ano nga yun? Yung parang schizotypal, mga ganan-ganan. schizoid, tapos yung, ano ngayon, yung sa babae, yung hypochronic, chronic ba yun? Kalimutan ko guys yung mga personality disorder. Histrionic pala, mga ganun-ganun. So, lumalabas na yan sa board exam. So, obsessive compulsive disorder is a form of anxiety. So, kaya nga, laging naghuhugas ng kamay 30 times per day, gabi maglinis yung mga may OCD, obsessive compulsive disorder. Kasi takot na takot sila maging anxious. That's their way of controlling their emotions. So the correct answer is they have to keep from feeling anxious. He has changed clothes 20 times. Grabe. Chew each bite at least 24 times and go up and down the stairs 4 to 5 times before it feels right. He is demonstrating. Alam niya na guys yan. 20 times, 24 times, 45 obsession and compulsion. The objective of nursing care for Jason is to develop or increase feelings of A. Self-mastery, B. Self-actualization, C. Self-determination, self-worth, or D. Self-determination. So, ang objective natin to care for patients with OCD or obsessive and compulsive is to have self-mastery. They have to master their emotions. They have to master na if they feel something like, for example, natitrigger sila, like hindi nila kailangan magugas ng kamay 20 times. Parang i-recognize nila, wait, na-anxious ako, natitrigger ako, so ano yung gagawin ko? So they have to do like deep breathing exercises or may mga exercises sila na pwedeng gawin as OCD patients. All of these are therapeutic interventions except for finding the right answer. Impose limits, tama. That becomes repetitive. Establish a routine, tama. Assign tasks that can be done repetitively. And then, D, facilitate self-expression. So, ano yung mali dito guys? Is yung C. Bakit? Sa word na repetitively. OCD na nga si patient eh. Ginagawa niya na nga yan 24 times, 20 times, 50 times. Tapos pabibigyan mo pa siya ng task na ulit-ulitin niya din. Baka matrigger ulit yung pagka-obsessive niya. So, bawal yan. Last number. Jason is aware of his behavior, yet realizes that it is very disturbing to him. This is a pattern of neurosis. By definition sa Google, guys, neurosis is a mental condition that is not caused by organic disease. It involves symptoms of stress, depression, anxiety, obsessive behavior, and hypochondriasis, but not a radical loss of touch with reality. Yun. Aware siya, pero hindi niya pa rin makontrol kasi sobrang nadi-disturb talaga siya sa mga bagay-bagay. So, that's a neurosis. So, it doesn't technically mean na baliw sila or parang hindi sila aware sa ginagawa nila. Aware talaga sila pero hindi nila makontrol. So, these are really from anxiety and depression and hypochondriasis. And that's it. How's your score, guys? I hope nakapasa ka today. But don't worry, you just gained 20 points for the board exam.